मेरा नाम धनसुख जानी है। मैं गुजरात से 4 साल से मुझे गंभीर कैंसर था। कैंसर की वजह से मुझे पेट साफ नहीं होता था, मुझे भूख नहीं लगती थी, नींद नहीं आती थी, मैं कहीं पर जा नहीं सकता था, डायपर पहनना पड़ता था, मुझे बहुत मानसिक परेशानी थी। मैं बेंगलोर आया, एक दिन अचानक मुझे पेट में बहुत दर्द होने लगा, तो मैं यहाँ इमरजेंसी में दाखिल हुआ। डॉक्टर सुश्री शेट्टी सर ने बोला कि मेजर ऑपरेशन है, हाईपेक ऑपरेशन करना पड़ेगा। डॉक्टर सुश्री शेट्टी सर की बात से मुझे और उसके कॉन्फिडेंस से मुझे शक्ति मिली और हमने सोचा कि यही एक बेस्ट विकल्प है। मेरी सर्जरी हुई। इतनी बड़ी सर्जरी होने के बाद डॉक्टर के ट्रीटमेंट की वजह से सिर्फ 7 दिन में ही हॉस्पिटल से मुझे छुट्टी मिल गई। मैं नारायण हॉस्पिटल परिवार के सभी डॉक्टरों के साथ साथ सभी परिवार को मैं आभार व्यक्त करता हूँ और शुभकामना करता हूँ कि इस हॉस्पिटल के सभी डॉक्टरों को भगवान इतनी शक्ति दे कि मेरे जैसे जो जिंदगी गंवा चुके हैं वो यहाँ आए और नई जिंदगी पाकर अपने घर जाए।
Hello, I'm Dr. Sushruth Shetty. I'm a consultant gastrosurgeon and a GI oncosurgeon at Narayana Health City, Bangalore. Appendicular cancers are rare form of cancers seen in our population. They're usually diagnosed post-operatively when somebody undergoes an appendicectomy for pain abdomen and the post-operative histopathology shows cancer in it. Rarely they are diagnosed in preoperative imaging, wherein an ultrasound abdomen or a CT scan shows a mass in the appendix and sometimes localized to the appendix, sometimes spread to the adjacent peritoneum as mucinous deposits, in which case it is called as pseudomyxoma peritonei. One such patient of pseudomyxoma peritonei is our patient Mr. Dhansukh Jani, who was diagnosed to have appendicular cancer 10 years ago. He was operated in the form of appendicectomy and followed by another surgery in the form of right hemicolectomy around 4 to 5 years back. Since then, he developed something called as pseudomyxoma peritonei, wherein the mucin gets deposited inside the abdomen and his abdomen has progressively been increasing in size since then. From the past 1 to 2 years, he has been suffering significantly because of the size of his abdomen and inability to have a normal bowel function. In spite of his advanced age of 72, he was quite a determined patient and he was willing to get back to his social life as early as possible. We subjected Mr. Dhansukh Jani to CRS HIPEC surgery, which lasted for about 8 to 10 hours, wherein we could successfully remove all the tumor tissue from his abdomen. And later on, we perfused his abdomen with chemotherapy drug delivered through a specialized machine which heats the chemotherapy drugs to a temperature of 42 to 43 degrees centigrade and runs for 60 to 90 minutes. Post-operatively, he showed a good recovery. He stayed in ICU for about 2 days and we were able to discharge him home within 10 days. This tremendous recovery was possible because of the contribution from our intensive care team, from our nursing team, all the allied departments including physiotherapy, etc. Now he is happy. He is able to attend his social responsibilities. He is able to go out for dinner, go out for lunch. He is living a near normal life after 2 months after surgery. Appendicular cancers are rare and even their treatment is slightly different. Some of these patients with peritoneal metastasis need cytoreductive surgery and hyperthermic intraperitoneal chemotherapy, which gives a good survival benefit. These surgeries, though supramajor, can be done safely at centers equipped with a good intensive care team, good anesthesia team, and good post-operative care. We wish Mr. Dhansukh Jani a good recovery ahead and hope he is able to enjoy his life to its fullest. Thank you.
I am Dr. Rohit Ranade. I am a consultant gynec oncosurgeon, a peritoneal surface oncology expert, and a HIPEC super specialist at the Narayana Health City in Bangalore. Pseudomyxoma peritonei is a slightly less common condition which occurs in patients. It can occur both in men as well as women. The major reasons which can happen are because of the cancer of the appendix, and also it can occur in the mucinous cancers of the ovary. Now, it is a condition where the entire patient's abdomen gets filled with jelly, and there are all multiple deposits spread across all over the abdomen. Now, this condition is definitely treatable, and the standard of treatment for this is a procedure, ultra radical procedure known as a cytoreductive surgery and HIPEC. Now, this involves a very maximum surgery, that is something like an extensive surgery lasting from 8 to 10 hours, where the entire peritoneum of the patient's body is removed along with all the affected tumor deposits is removed. And after you have achieved removal of all the disease, something we call it as CC0, you put chemotherapy at a higher temperature and a higher pressure inside the patient's abdomen, which is called as hyperthermic intraperitoneal chemotherapy or HIPEC. Now, this chemotherapy may last for around 60 minutes to about 90 minutes to about 2 hours, depending on what type of cancer are you treating. Definitely for pseudomyxoma peritonitis, cytoreductive surgery with HIPEC has level 1 evidence, that is the maximal evidence which is available, and this has definitely shown to have a great benefit for survival for these patients. We are very happy that our 72-year-old young patient, Mr. Dhansukh, has done very well after a radical CRS and HIPEC procedure. We wish him all the best in the future. Thank you.